Welcome to GutTalk TV by DAB, a YouTube channel focused on closing the communication and knowledge gaps in gut health. Please press the subscribe button below.
Hello, I'm Dr. Yoon,
And I'm Dr. Jakob, and we're gastroenterologists in Australia.
and we are today going to talk about irritable bowel syndrome and how to manage that. And especially in this video, we'll focus on how to manage constipation and bloating symptom, and we'll pass on a few tips on how to flatten your belly. So first, we're going to start with how to train your bowel. Usually the constipation and bloating comes together because your stool stays there for a long time and it ferments and bacteria produce a lot of gas and you get the bloating sensation. So it is important to empty the bowel. And Dr. Bigan, what would be the best way to treat the constipation?
So constipation has two components to it. One is the form of the stool. In constipation, we tend to have hard stools that are difficult to pass, and then it's the frequency. So normal frequency is having a bowel motion up to 3 times a day or as rare as once every 3 days, and what we want to do is increase the frequency. And we do that with two main approaches. One is a stool softener to soften those hard stools, and the other is a laxative to increase the frequency. So on the stool softener front, we often will use detergent-based therapy or a surfactant. Something like Caloxyl is a commonly used stool softener. And on the laxative front, we prefer to use non-stimulative laxatives because these are safer in the long term. And these laxatives are osmotic laxatives such as Movicol or Osmolax, which have the same active ingredient. And they come in a variety of forms, powders, as sachets or as tablets. And no matter how you take them, I think that they're both pretty effective. In general, we try to minimize the use of stimulative laxatives, although we sometimes have to use them to get things going. And those include things like Senna, which is often marketed as Caloxyl and Senna, or Senacote, or Laxettes. And another common stimulative laxative is Bisacodyl, or Dulcolax.
And some natural way of
Oh yes, and sometimes we like to use natural laxatives as well. There are fruits that can be naturally laxative in their effect, including prunes, which have been used for decades, and other fruits that start with P, coincidentally, things like papaya, pawpaw, or pears, all have laxative effects. And then coffee is a commonly consumed beverage that also has laxative effects.
And it is important to do that properly. So make sure that you give yourself enough diarrhea initially, so you get your overflow diarrhea at initial dose of it. So don't stop your medication when you start having diarrhea. You have to give yourself about 2 weeks of diarrhea before you know that your bowel is effectively empty. So you start with a higher dose, like a 2 sachets of Movicol in morning and night time for 2 weeks, usually is my take, and then you can back off on the dose and find the right dose for you. Make sure you be patient. It can take a few months to ease to really reset your bowel. And Dr. Bigan, the other thing that people usually ask is how to use fiber correctly in treating constipation.
And fiber plays an important role as well. First, you want to empty the bowel, as we've discussed, using laxatives and other methods. But then once you've achieved that, emptied out the bowel, we want something to help give the bowel form and to keep things moving through the bowel. And that's what we use fiber for. It comes in two main categories, soluble fiber and insoluble fiber. Insoluble fiber is probably used most commonly. That includes natural things like psyllium husk, which are also marketed as Metamucil or Benefiber in the chemist, but also soluble fiber, which is pectin or guar gum, and a commonly used formulation is Normafiber. The important thing with these is that you have to have plenty of water when you're taking the fiber. You have to mix in with water, so example, 1 to 2 teaspoons of fiber mixed in with a glass of water, maybe 250 mils, followed by another glass of water right after, and shooting for consumption of at least 1 liter of water a day.
That would be great. And in addition to that, then you will lead on to right food intake that will help with irritable bowel syndrome. However, we'll take that in the next video to talk about that more in detail, because I think we need to talk about that in detail in separate session. Next one will be then medication. Is there any medication that can help with bloating? So we talked about constipation, now the bloating. What are the medications that might be very helpful?
So as we mentioned, bloating is often caused by or exacerbated by constipation. So sometimes when you treat the constipation adequately, the bloating goes away, which is great. But sometimes we need something extra to treat the bloating. And generally, in addition to the bloating, there's a sense of discomfort that comes along with it, which is often spasms from the smooth muscles of the bowel wall causing that. And so for that, we like to use antispasmodics. A commonly used preparation, which is natural, is peppermint oil, which is a nice potent smooth muscle relaxant, and so that can be taken as peppermint oil itself or in Mintec, for example. There's also a preparation that we use a lot in bloating predominant irritable bowel syndrome called iberogast. That contains peppermint oil as well, but also a variety of prebiotics that may help with this. And finally, there's a new product, or a relatively new product on the market called Energast, and this contains butyrate, which is a short-chain fatty acid produced by the bacteria in the gut, but also being taken as a prebiotic that can help with that bloating and spasm. Now, sometimes even when you treat the bloating, there can still be pain left over, and that can be really quite disabling and debilitating. And it's really important to address that as well. Are there any go-to medical regimens that you have for treating the pain component of irritable bowel syndrome?
So we commonly use neuromodulator medication. So common thing is amitriptyline that you probably heard of, and the brand name is Endep. What it does is on a high dose, when you Google it, it will say antidepressant, but that's not the dose that we are using it. So we are using the fraction of it, and it addresses the cause of IBS, which is visceral hypersensitivity that causes the pain. So this medication will down the signals, so it's not overfiring a lot of pain signals to you. So you usually take at nighttime because it makes you a bit sleepy. So it helps with your insomnia too if you're suffering from it. It takes about 2 to 4 weeks to get used to it. So proceed with it even though you're not having a great result. You can start with 1 tablet a day, but you can increase up to 5 tablets a day very slowly if the symptoms are not improving. So that's wrap up the whole medication part of it. I hope you find this resources valuable. There's more videos coming that will address different side of irritable bowel syndrome management. If you have any questions or comments, please leave a comment below, and don't forget to subscribe.